Oh man, that's a great question, and it really is something that we do struggle with, not just in Cape, but nationwide, especially when you talk mental health care and support for these individuals. But even if you're just talking something as simple as a medication refill, there are a lot of medications that you have to see your provider before you can get a refill. And so if it's going to take 2-3 weeks in order to be able to follow up with a primary, sometimes that can get really difficult for patients to then maybe get the medications that they need. So there's definitely an impact on that. But I think where it's really a struggle is having those mental health professionals that see people outpatient. That's something that's just so needed and so few and far to come between, and the ones that we do have are just booked solid for months at a time, and that's difficult.
When you think about like the challenges to get providers to the areas or like what is causing some of those provider shortages, it's a little bit different. So in rural areas, you're looking at more like recruitment issues and like facility closures. So there's less opportunities, but also it's harder to get providers to those areas. And then in urban areas, it's usually like lack of providers, like, or like the scoring there is, there's high demand because you have a higher population in those areas. There's high turnover. And then there's a lot of specialist over concentration in more of the urban areas, which can result to like higher wait times to get into like your primary care providers. So the consequences are still going to be the same. Like if the population can't get in to see preventative, care providers, then it's still going to have some of those same health outcomes, which increases the need for some of those specialty care or other or like emergency room visits.
So the benefits of having an on-site clinic is, number one, we're dedicated to just the students, faculty, and staff. So wait times tend to be a lot shorter, and you're not having to share services with the general public. But also is location. It's an easy walk from many of the dormitories, so there's not this barrier of access with transportation. Also, the way I treat students is a little bit different than a traditional, like, urgent care. I mean, it's just more of a personal relationship as opposed to cut and dry professional relationships. So a lot of times students are more comfortable coming here as opposed to outside sources.